Welcome to Lean in Olympia, Interfaith Works bi-weekly show where we cover various topics, including at the conversation. Let me start that again. Welcome to Lean in Olympia, Interfaith Works' bi-weekly show where we feature conversations at the crossroads of humanity, justice, and belief. I'm Meg Martin. I'm the executive director of Interfaith Works. If you want to check out past episodes or stay up to date with the work that Interfaith Works is doing, please visit our website, interfaith-works.org, or check out the Interfaith Works Facebook page and our YouTube channel. Today, I am super excited to talk about a subject that's very close to my heart, one that is often extremely polarizing in our community discourse, and one that is deeply intertwined with the daily work that we do at Interfaith Works. Substance use, addiction, and the impacts of substance use on lives in our community. This issue touches every single one of us in many different ways, and it can be very difficult to talk about. I would ask our viewers today, especially those who have lost a loved one due to overdose, to please take care when listening to this conversation. Each one of us on this call today is intimately aware of the pain and trauma associated with losing a loved one to addiction. So please know that you're not alone. Take care of yourself, take care of your heart. And I hope that this conversation is a meaningful one for everyone today. I'm honored to have an impressive panel full of lived experience and professional experience at the interpersonal, regional, national level. I'm thrilled to welcome Larry Jefferson, the new Director of Public Defense for Thurston County, and Katie Strozyk, the Thurston County Opioid Response Coordinator. Welcome, everybody. Thank you so much for taking the time out of your very busy schedules to be here today.
Hey, Meg, thanks for having us here. I just want to make a correction of the record. You know, I'm a lawyer and we do that. Again, everybody, my name's Larry Jefferson, and I'm going to be the new director of the Washington Office of Public Defense. So that's statewide. I currently work at Thurston County Public Defense, where I'm a senior attorney, and my last day is going to be May 14th, and I start on the new job for the whole state on May 17th. So I'm really looking forward to this.
That's so awesome. Thank you for that correction. So to get us started, I'm wondering if you could each share a bit about what motivated you to say yes to my invitation today to have this conversation and any personal connection you might have to this topic. Larry, would you be willing to start?
Yeah, I am willing to start. This is kind of hard, but this issue has really touched me professionally and personally. It's touched me as a father and as a husband and all those things. And recently, my son passed away in June of last year because of an overdose. But that just didn't happen in June of last year. We went through a decade of just struggle and, you know, just what do you do when a family member is very ill and they become an adult, and can you make the decision about can that person even live in your house anymore, and what that looks like? What is your house like? I can remember the first time that he went to inpatient treatment and we could watch TV in peace. And how guilty that I felt that I was watching TV, but they were away. How guilty I felt that I was like, I couldn't pick up a dish in my own house and make a sound with it because that might make them angry if they were under the influence at that time. And I couldn't read the signs at that time. So and so you get into an argument over a dish, and then it would explode and become this horrible thing. And I didn't know who the person was who was in my house. Yeah. So that just shattered the foundation of my family in ways that I'll never be able to recover from. On the other hand, I've done a lot of work with self-care. I've had a lot of communication with different family members have changed my life. Um, and those have really helped to where if I need to cry right now, I got a whole list of people on my phone that I can cry with and be upset with and to really honor my son, Jandon, Jefferson champion memory, because he was awesome.
We love Jandon.
He's this unbelievable guy. So,
yeah.
And, so that's why I'm here. And then as an attorney, to see the harm that our legal system continues to do on traumatized folks who are ill, and to treat it as a crime, and to know that racism is the cause of that, and that the consideration that slavery has not officially ended, and so mass incarceration is a part of this, and part of mass incarceration was making the drug laws that were used to harm Black and Brown communities, and it spread through the opioid crisis to affect all of us, so all of us have been hurt and traumatized by this. Even if we haven't lost a family member, we're spending more money because of this, or we feel like we can't go downtown because we're afraid that we might meet someone a part of this. That's a harm. So what I've dedicated my life to is meeting people where they are and not traumatizing them when they've already been traumatized. So that's what I'm trying to do. That's why I agreed to come on here and talk about these issues. Thanks.
Thank you. Well, I want to just say that so much of the work I do too is in memory of people that we've lost. And my dear cousin, Brock Hovey, he passed from an overdose in August, and he was like a brother. And I'm wearing you can't quite see it under here, but I'm wearing my Whitney Houston shirt today. So we, all of our work is in memory of the ones we love and the ones we cherish. So Katie, I'm wondering if you could share a bit about what motivated you to say yes to my invitation today.
Yeah, I mean, I do have to say, I think I cry on meetings with Larry weekly, if not more than weekly at this point. It's just a regular occurrence now. I've dedicated the last 7 or 8-ish years of my professional career around behavioral health, but specifically looking at drug use and drug user health, and like what Larry was saying, how to meet people where they're at specifically, not just looking at treatment and recovery, but looking at harm reduction and really making sure that people are treated with dignity, because unfortunately that's really few and far between in a lot of service providers right now. I got rooted in this work because I am a person with lived experience who used drugs before, and I was really tired of seeing people around me die and seeing the way that people around me in the community who didn't realize the connection that I had to certain populations talked about people. It hurt to see people on Facebook or see people in meetings talk a certain way, having a total disconnect and thinking, wow, that was me. Those are my friends. That was that person's funeral that I was at last week. And really wanting to make sure that with everything that I could harness through being in a place where I could go to higher education and things like that, that I was able to use all of that to do something that would have a direct impact on the people that I love most in my life. Just like both of you, I've lost countless loved ones to overdoses. I have a lot of people who have overdosed who are still here back behind me. There's actually vials of Narcan that I used to save people that I love. So it's kind of a morbid thing, I guess, to collect, but any chance to be able to bring light to drug use and the struggles that come with it, and then also the impact that drug use can have on both the individual who's using drugs as well as those people around them.
Well, I really appreciate that, because I often find that in conversations about drug use in our community, the spotlight is often placed on the individual who's using and personal choices that they are or maybe are not making. Do you find that that's an effective frame for dissecting drug use in our communities from your perspectives, that focus on the individual user?
No, not at all. This is about all of us. We're all a family. We're all human beings. We were born, and when we were born, we were just delightful, just wonderful. I've got this mass incarceration thing I do, and I always start off, there are no evil babies, right? There just aren't. I've never met an evil baby. But what I have met is people that have been harmed through trauma, people who feel disconnected, people that are looking for some sort of connectivity. And sometimes they find that through drug usage or friends or a community that's accepting of who they are, only there's destructive portions on it. So just focusing on the one, that is assuming that our society is great. That is assuming that if you say the phrase, make America great again, that it was great at one time. I can't find a time that I want to go back to. Maybe there's a couple times like in the 80s or where I saw Star Wars in the 70s that I would say, take me back to that. Boom. But really, no. I mean, there's how many isms are there? I don't want to go back to that. So if someone is saying, hey, I don't want to be part of this greater society, I want to do something else, and we want to tell them that that's wrong, I don't necessarily agree with that. People should be able to find their own way, their own path. We live in a capitalist society that values money more than it values a human life. So who would want to be part of that if you value human life? I want to value human life, which means I don't really care about money. I mean, I like being able to go to the store and buy what I want and have a place to live. That's great. But, so if you're questioning all these things and you're finding, hey, I'm not going to be some middle-class person, blah, blah, blah. I don't want that. I think a lot of that can go into this issue. So it's more about all of us and how we all want to live together without harming one another.
Yeah.
I think that also when you only focus on the individual who's using drugs, it creates kind of this binary in one box reaction where it's like somebody's using drugs because they're choosing to, and that's the only option, where it takes away all of the other factors in their life where they may be using drugs. It may be for survival because they use meth because they're houseless and they need to stay awake to protect their stuff and their person. It may be that they have incredible physical pain that they're dealing with, and so they're using it as a painkiller. It may be all types of other behavioral health, trauma, environmental impactors that when you just focus on the individual using drugs themselves, you take it away and you put all of the fault on that individual where there shouldn't be fault assigned.
Mm-hmm. Yeah, which then, breeds the shame spiral, which then to escape the shame, you use more. And I know that that's true for myself in my own lived experience with using drugs, is that you would hide in the shame and the hide in the shame and the hide in the shame, and then it just kind of builds and builds and builds upon itself. And the weight of all of those things that you just said, of the trauma, of the environmental factors, the society that we live in, how hard it can be to get help when you need it and when you want it. I often hear folks that are just like, well, we only want to help people that want to help themselves. And I can't tell you every single day people that I talk to that want help, desperately want help. And it just either isn't there or they can't get it in the moment that they need it in the way that they need it. And then again, all that blame goes onto the person's shoulders. And it's so difficult at that point to, evolve, or rise out of that weight. But yet people are doing it every single day. And it's such a resilient and beautiful thing. I'm wondering if what do you think is the most common misconception when it comes to people who use drugs that our community has?
That using drugs is inherently a moral failure of an individual. And that someone using drugs is automatically their choice and they are a bad person because they do so, and that there's no other considerations. It is they are automatically a either bad or lesser person because they're using drugs. And I think stigma wraps all around that, but it's just really that that split level decision that that person uses drugs and so they're lesser than me and I no longer like them because they're choosing to do that.
Yeah.
I couldn't agree more, and I don't have anything to add to that. It's just spot on.
Yeah, I was looking up when I was prepping for this conversation, I looked up the most recent data from the National Survey on Drug Use and it's from 2019 because I think they do it every 2 years, and it shows that 165.4 million people reportedly used a substance in the past month, 60% of the overall population in the US. And I think that there's also often this like hierarchy of substances that comes into place, that we socially accept some substances that are extremely dangerous, such as alcohol, and we completely deny the acceptance of other and stigmatize other substances that people use.
Meg, I couldn't agree with you more. I'm sorry to interrupt, but we have like a DUI industry, like that involve cops, that involve the testing, the DUI machines, the DUI treatment, and alcohol causes, in my legal opinion, or what I've seen, so much more harm than cocaine or heroin, or not that you don't see accidents where people have used those substances. They're just in proportion to alcohol. They're very, very few and far and in between. And it should be just as easy to get services if you're having alcohol issues as if it's a medical issue. It's just a medical issue. I think that's one of the things that has been harmed the most by the war on drugs, is it made it associated with certain groups of people, and that those groups of people were bad. And so you didn't want to have anything to do with those groups of people. And for those of you who need me to say who those groups of people were, that's Black people and that's brown people. And that's, look at who sang Strange Fruit, Billie Holiday. You know, Harry Anslinger ran an agency that started the war on drugs in the 1930s, 1940s, all and targeted. Watch that movie, United States versus Billie Holiday. That is the mentality that we are using towards people who suffered trauma. These are humans that are hurt. They need love, affection, care, and they haven't gotten it anywhere. And so a person who uses drugs, who is just looking for a little bit of relief, sometimes just relief, and we want to say that they're bad for that. I completely reject that. You know, in fact, what they are is good. They're good people, because we're all good people. We're good people. We were born good, and it doesn't change. And so what we got to know is that these people are our brothers, our sisters, our mothers, our grandmas. That's who these folks are. This is us. And so when we're putting someone away, we are creating a disconnect. And what we would need to do is bring people closer and have more connectivity, so people can, when I have been shamed over something, it is so hard and difficult for me to find a person that I can express that to, you know. And so for me, that wasn't over drugs, it was over other stuff that I won't talk about. But when you are able to have that release, it's such a lift off that you're not worrying about that anymore, because you can find someone to, and that can happen with all sorts of issues. Oh goodness.
Yeah, I think that there's this like phenomenon that I don't quite know how to articulate exactly, but I feel like when it comes to sort of our community discourse, and many communities, I don't think we are unique in this, but the community discourse around addiction and kind of like what should we do about it, and that we tend so intensely to focus on like the smallest, most like exaggerated fear-based point of it. Like I also looked up, just out of curiosity, the HUD annual point in time count for the same year, 2019. And even if every single person counted in the point in time count, which is how folks experiencing homelessness are counted throughout the country, even if every single one of them had a substance use disorder, it would only account for about 3.5% of overall substance use in our country. Yet I find that discourse about addiction in our community is often focused almost entirely on people experiencing homelessness. And I'm like, what is that phenomenon? Do you find that that's true too, that there's this like hyper focus on kind of the I don't know. Do you know what I'm saying? Like, I don't know how to articulate it exactly.
So Larry touched on it a little bit, but it very much, I think the hierarchy, as far as I've seen, is built on a things I'm not comfortable with and populations I do not fit in with nor want to be in, because it really comes down to race and social class. Because if you look at the drugs that we so commonly look down on as a society, you're really looking at things like meth and heroin. But for individuals who are like in the news all the time as rich elite who are very outspoken about drinking heavily and using cocaine and taking Xanax, that's applauded and that's fine. But when an individual is houseless and using meth, all of a sudden that is the worst case scenario and that person is an issue. And it's what Larry's saying is it's all correct. It's that the war on drugs is inherently rooted in racism, but then also there's the classism part of it as well, is that when you narrow down these drugs, which they're cheaper than other drugs, if we're being honest, it's easier to get meth and heroin for a lower price than other drugs. It all of a sudden separates that us versus them. Oh, I would never do that. I would not want to be that person. When really using substances in that way is no different than the person who's going home and drinking a few beers or doing something else. It's just that we've really handpicked which substances we're okay with and which ones we're not. Part of that in our society comes down to regulation, has a large play in our belief around it. Because alcohol is regulated, suddenly it's okay. Because weed is regulated, it's okay. But because someone is buying meth on the corner downtown, that one's not okay to us. So we've created this comfort zone of what we're okay with and what we find is morally acceptable for people to take, whether it's in excess or not, whether it's impacting them or the people around them or not. And we've created this tiny box basically of these substances are okay if this population uses them. And if any other population uses something else, it's totally not okay. And it's this bad thing and it's that person's fault that needs to be fixed.
Yeah, I agree with that. And one thing that comes to mind is that I think inequities build off of other inequities. And so I'm going to go to the first inequity. People lived here. This is Squaxin, Puyallup, and Nisqually land. And that land was taken from those folks. Then other people were taken from their land. So you got, stolen land, stolen lives, and stolen labor. So you have all of these things that create this base for toxicity. Then you get folks who use an issue, meaning trauma or people that are taking drugs, and use that on a race-based function, like I talked about with Billie Holiday, which created this war on drugs, right? So that we have this thing that says, in order to be safe, these people need to be put in jail. Which it goes back to the beginning with where police come from, right? Which is they originated from slave patrols, and they got their training from take the Citadel, which is a training academy. I can't remember what state, but
Maryland.
Yeah, I mean, so they were training folks, and so that's become part of our culture. And you can see all the things that has harmed, right now with the way that Black people are dying daily from their interaction. So we've created all these inequities on top of inequities on top of inequities. And first of all, we need to realize it so that we can stop. And by actions of stopping means, hey, just meeting people where they are, realizing that folks have pain and being able to listen to it. It reminds me of every time I go to the doctor, they say, hey, what's your family history? Because they're listening for that, because it's important. And I think that's the thing that we need to do with other people is, hey, what's your history? What's going on? Because something happened to you after you're born in order for you to be doing this. How can we get it in a direction that you want to go? Not that I want to go. Doesn't matter where I want to go. I'm already where I want to go. But where do you want to go? And how can we get there? And that could be you using substances. As long as you ain't hurting nobody, I don't care whether you use a substance or not. I mean, it has, the doctor will tell you, like any commercial will tell you, if I use xylophone or whatever, it's got, it'll kill you, it'll turn you blue and turn you insides out. But the commercial makes it look like you're having a lot of fun. I don't know, as long as you're not hurting anybody. So we have this thing, this public safety. I've got up on my board, it says the fallacy of public safety. And so when you're talking about evidence, like what is the actual evidence, right? That's where we need to go and explain to people what's the actual evidence. Hey, is crime going up or is crime going down? Guess what? Crime's going down. It has been. Okay, so we don't need all these horrible. We don't need these drug laws, because that's not the impetus. We don't want to. People should get in trouble like for what they do, not for like who they are or the problems they have. And if they have problems, they're probably symptoms. And so if you ease the symptoms instead of relying on retribution, retribution doesn't get you a lot, right? It doesn't get you a lot. But if a person's issue gets solved, then they don't have that issue anymore, and then they can be happy. So, that's my reaction to what we're talking about.
Well, I think, I'm like, of course, in agreement with everything that you're saying. And I have this like kind of like itching voice, in the back of my head I've been doing this work for a really long time. I've faced a lot of community pushback in really big ways for, advancing programs that are based on a harm reduction model that accept people where they're at. And when we were opening the shelter 6 years ago, that was like a very radical take on things. And there was a lot of fear that kind of came from that. And so I'm always sort of keeping in my mind, what are the other conversations that are happening in our community outside of here? And how easy it is, I think, for folks who might not agree with where we're coming from to say, well, then what? Like, then lawlessness, then nothing, then so what does accountability look like when it comes to substance use and addiction? Like, what do you think of when there's sort of these cries for accountability and for someone to do something about the addiction crisis in our community?
Katie, you want to go first?
I think the accountability argument is kind of an interesting one, because I often hear it from law enforcement and talking about the need to arrest people strictly on them having substances on them, and that it's holding them accountable. And so we need to arrest individuals. And I'm always just baffled by that, because in my head, it's like, no one needs to be accountable to me for what they're putting in their body. Like I don't want to be accountable to other people for what I'm doing with my own body. So that just seems totally odd to me. I think that accountability ends up coming down to, if you provide wraparound services in a really meaningful and person-centered way, you should be able to, if we had the perfect system, be able to meet the needs of an individual to reduce the behaviors that are unwanted in our community. So for instance, people always talk about accountability with people using drugs, and that accountability means they stop using drugs. But when you kind of dig down deeper, people are like, well, I know this person uses drugs, and I also know that they stole stuff from my mailbox and I didn't like that. So it's not the drug use that people are actually disliking, it's secondary behaviors. And so if we're able to support people enough where they don't have to engage in these secondary behaviors that affect other people by providing housing, providing other supports, providing medical services, providing treatment on demand and things like that, where people don't have to act out in ways that are going to affect others, then the public perception and the issue with drug use, I think, would drastically decrease, because people would no longer feel impacted by people who use drugs. People just don't want to be impacted by other people. And so that's what they're seeing. And so I think when we look at accountability, it's looking at the secondary behaviors besides just the actual drug use, and then looking at how we can address those in a way that isn't punitive and criminalization. Like, that person's stealing while they're using drugs. Well, why are they stealing? Like, is it that they don't have an income? Are they stealing food? What can we do to support that person so that they don't need to steal? This person is trespassing. Okay, do they have housing? Like, how can we support this person so they don't have to engage in this behavior anymore, regardless of their drug use or not?
Yeah, I guess the way that I look at it is that crime is a symptom of something else. So people don't normally act in a way where they harm other individuals. That's just not what people do, unless they've been harmed by something. And so why I brought up that what doctors do and they ask you your history is some of the things that Katie talked about, which is, I got this up on my board, which is housing, education, employment, environmental justice, agricultural equity, and medical care. So let's say in your history, you don't have access to all those things. How are you going to live, survive? Like in my own instance, my own life, I got lucky. And where I got lucky is in the issue of housing, because we don't think about segregation. So in Thurston County, there are covenants that say you cannot sell property to Black people. It's not enforced nowadays, but it was. And so that hits at an issue of generational wealth. And if you don't have access to this stuff, then you got to figure out a way to survive. So if you're penalizing someone because of something that they can't control ever, that doesn't make a lot of sense. So we have to use crime as a way to get to, hey, what's the history? Where are you coming from? So that we can solve whatever the issue is. All my clients just wanted to go home, right? And if you could solve the issue of why they were there, they pretty much wouldn't commit crime anymore. But what we're dealing with is folks who have been so traumatized that that's the only way they know how to live. And so, other societies and other cultures, they don't have prisons, right? They didn't have prisons because they didn't need them. They dealt with them in other ways, right? By being a community and saying, and the community coming forward, well, we don't do that here, right? And so there are ways that we can go forward. We are starting to change that with programs like Familiar Faces and the Seattle Lead and those things where we meet people where they are and don't always hit them. We're too into retribution in our culture right now. Someone must be punished in order. Some people don't need that. You just tell them, hey, don't do that. And they stop doing it. And each person's an individual about what they need. Some people need more than that. We want to do the least amount of directing so that people can direct their own life. If I'm directing somebody's life, they're not really leading a life, right? And so that's what we do with prisons. And also we need to realize that the places we've been sending people to, prisons, don't make people better because that's not what they were meant to do. So we need to stop using them because they do more criminal stuff. Who was the old phrase? If you're a dog and you lay down with other dogs, you get fleas, something like that, right? So it's about who you're with. And we want people to be like, when my kids got in trouble, it wasn't that I sent them over to the neighbor's house. You need to act better. They hang out with me because I wanted them to learn my values, right? And so when someone's in trouble, I want them to hang out with me. I want every client I have, I want them to be able to come over to my house for dinner and to have it be a nice, pleasant experience, where we're just, shooting the stuff and doing barbecuing, drinking lemonade. That's what I want to do with my neighbors, even my neighbor who hit me or whatever. What I want to do is in time, maybe it takes some time, but I want them to be able to come over and say, oh, I'm sorry about that. And, and it's about voice. I want to be able, our society doesn't let people have voice. So
Yeah.
even victims come forward and they get shoved in the face and go, no, 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 we can't listen to you right now, which is not fair. People need to be able to talk and express, and we've made these adversarial systems that are just punching each other when we could be listening to one another. And so what we got to do is reframe what we think of as justice, which is generally one person talking to another person about how they felt over something. I mean, that's how it works in a lot of my relationships where I make mistakes. The other person goes, well, this is how I felt about what you did. And then I go, oh, really? Oh, huh. I guess if I want to have a relation with you, I can't do that. Or I need to, change something. That's where we want to get to. And it doesn't always have to be about someone's got to go to jail or whatever. Accountability is just living with each other.
I think also with what Larry's saying about accountability and with voices being heard is that, one, we expect people to be held accountable by the criminal legal system, which just creates more barriers, which make it harder to fit that in the future. It's harder to get housing. It's harder to find a job. It's harder to meet all of those needs that Larry's talking about. And then also, when you're talking about people having voices, accountability means that somebody somewhere decided what's right or wrong, and it no longer matters what you want or what you think is right or wrong. And so you're having everybody be accountable to fit into this box of norms, which maybe the norms that you're used to aren't the norms that they want. Not everybody wants a white picket fence and a house and a car and a 9-to-5 job. And that doesn't mean that they're not being accountable for their own life. It just means that their norms and what they want is different than theirs or different than yours, and that shouldn't be something that we're acting punitive in response to.
Yeah, and I think that what that requires is believing people and trusting people about what they say they want and what they say they need their lives to look like. And I think that that circles back again to the race and the class issues of like, are we prepared to believe poor people? Are we prepared to believe people of color when they say, this is what I need my life to look like? And I think that that is so much of what hinges in this discussion and just stalls any type of meaningful progress. And I think about that with the homelessness issue as well. It's like, love them or hate them, we want the same outcome, which is for people to be off the street, out of wooded areas, out of doorways. And it's like, we actually do want the same thing, which is healthy, happy people in society who don't have to be dependent on mind altering substances to feel safe. Like that's what we all want, but we can never even like necessarily get past that point to figure out what works. And what really trips me up too is that a whole nother system that we're not even really bringing into the conversation quite yet is the industrial complex of treatment that we have in this country, and how even when people do get treatment, it's incredibly ineffective. And it's a hundreds of billions of dollar industry that again prioritizes profit over people. And so I often hear folks that say, well, no, I don't think we should throw everyone in jail, but I do think that everyone should go to treatment. And it's like, well, that doesn't work either though. And there's so little understanding about that in our community. I feel like, what do you all think about that?
I think people think that treatment is a magic wand, and there's this great golden staircase that goes up to a treatment center where people, when they go to treatment, go the same day, and there's no other conflicts in their life that they have to take care of. They go to treatment, it meets all of their needs, they come out, they're no longer using drugs, they have housing and a job, and it is like this magic merry-go-round that works perfectly, and they don't realize the complexities of a lot of treatment centers suck for people to go to. They're uncomfortable in the way that treatment should not be uncomfortable. Treatment's going to be uncomfortable by accessing it because it's a big change to your life, but having things that are not meeting your cultural norms and things like that that you need for just like a certain level of living, that's not an okay discomfort. And that's not something that someone would want to be in, not to mention the complexities of, okay, well, what if I'm houseless? When I go to treatment, all my stuff is going to be gone. Where am I going to go? Because you're not discharging to a home magically. Or if you're employed, how do you take 60, 90 days off work and have a job when you come back? What do you do with your dog when you have nobody you trust? And then also I've had friends who have been sitting in jail being like, yes, I want treatment. I want to go to treatment. And they say, okay, we'll get you a bed date. And it is 4 weeks after their jail release date, even. It's 6 weeks out. And so not only are they going to have to wait 6 weeks, but they're going to have to release from jail and then wait and then still somehow get to that treatment facility. And it's so inaccessible because you're not just talking about someone being ready. You're not just talking about having insurance or a payment mechanism lined up. You're also talking about, well, especially if you have a behavioral health issue or mental health issue on top of it, that treatment center might be 6 hours away. How are you going to get there? What about any sense of community you have? It's not, treatment is the most inaccessible option ever. Unfortunately, it's more successful than jail, but it's still, there's so many barriers, and there's so many barriers that people don't think of because they're not the ones being removed from their daily life for the next month or two of their life.
Yeah. Another thing that I found is most treatment is Christian based. Mm-hmm. And if you're not Christian, then if you're not participating in the activities, then you're seen as being anti-treatment, when that has nothing to do with that. Treatment centers aren't removed from the rest of society. So all the isms are there. I know in my experience, they had a lot of issues with racist staff. Mm-hmm. So you'd be there, or racist staff, but also the other clients being racist, mm-hmm. or going to treatment in a place that's not your community. Mm-hmm. So we do a lot of things that are not human-centered. So we need a human-centered approach, which is what we started off, which is meeting people where they are. Some people don't need to go to a treatment facility to do it. People do it on their own all the time, without any involvement or getting any insurance. They make a decision and they stop and they stick with it. Other people need more assistance with that. And so I'm losing my train of thought here, but I think, it's because I have a lot of pain in this area, because my son was at treatment and got kicked out over cigarettes. Yeah. And one thing that my son did is he protected everybody that was around him. That's why he couldn't go to high school, because he was too busy protecting his classmates from the authority figures there and getting into trouble. I could never get him to stop. I could never get him to stop offering shelter. He had an apartment once, and it wasn't his apartment. You know whose apartment it was? It was everybody in Olympia. Anybody who would say, hey, I need a place to rest. I go over there, and then people setting up living in the bathroom. Yeah. Because that's the kind of heart he had. He had a heart that was human-centered. We need a heart that is human-centered. If a person needs a place to live, guess what? They get a place to live. If a person needs medical care, guess what? They need medical care, and they get it, right? That's what we need to do. So what do you talk about? That's what you talk about, this basic income. You know, we have a society where we have athletes that get thousands of dollars for hitting something or whatever. And not that I don't love football or baseball. I do. I don't know why we have to play it for so much, right? Or whatever. I mean, it's cool stuff to do. But we've got corporations that have people at the top that make a decision, oh, let's do this. And they make millions of dollars for not doing anything. And so we need to rebuild our world, and a world that is human-centered. And it would really help with a lot of these issues so that people could get there's no reason people can't get what they need. And you say, well, there's too many people. Well, no, there's just enough, the right amount. And we can do what we need, and people can get access to healthcare that they need so they can make decisions about their own bodies and what they want to do with them. Shoot.
Yeah, lack of resources isn't the issue. It's how it's distributed and who's getting it and who's not. And You mentioned universal basic income or guaranteed income, and that's something I'm extremely interested in as well. And there's been a lot of pilot projects, most notably in Sacramento, that have been extremely successful with guaranteed income programs. And they have gotten a bunch of mayors to sign on to a mayor's agreement to try to do a basic income pilot project. And so that's something I would really love to see in our community, either at the city of Olympia level or at the Thurston County level. But I think like out of the box ideas, kind of like that, I'm wondering, who else is doing it right? What new ideas do you think that we should be trying to better support people in their recovery, whatever that means to them, whatever that looks like to them?
Well, before I mentioned programs like LEAD, Familiar Faces, Arrest and Jail Alternatives,
Will you talk a little bit about what those are for some of our folks that might not know?
So I guess I'll describe it this way. There are folks downtown that we see all the time, and they look like they're having a hard time. And so many years ago, those folks would just continue to have a hard time. Well, what these programs do is sometimes officers identify, hey, this person looks like they're having a hard time. They go on a list. And then a couple of peer support counselors, usually people with lived experience, meaning they've been to prison, and they're in recovery from drug use sometimes, go out and start connecting with folks. That's what happened with my son. And over time, they gain trust with the individual, and the individual will look at them and say, hey, I think I need help with my teeth, or I think I need, a shelter. Can you help me do that? And they start that process. It's not a linear process. So it doesn't go from, they meet on the first day and then the second day they're in treatment. It's years of people learning skills that maybe they didn't have. So there's also a crisis response team in Olympia. So when someone's having a crisis, the crisis response team shows up in a van. It's awesome. And they listen to the person. And then they say, hey, do you need a hotel room for a couple nights? And they go, yeah, great. Then they get the peer support people to come and meet with them, and the peer support connect them to other places throughout the whole community. And then the community is able to get together. Usually it's a Tuesday or Wednesday. Stop on by, sign a release of information, observe it. People talk about issues that folks are having, and they try to address them, from housing to treatment to all sorts of things. And so something magic happens in this process where you finally have this problem: laundry. You're like, laundry? That's not a problem. If someone has the problem of laundry, it means they want to change their clothes. If someone wants to change their clothes, it means they probably have a place to live. And so what we're trying to do is have laundry problems. I want to have laundry problems. And so that's the magic of these programs. And what they don't rely on is every time that person throughout this time period, people are still doing the things that they learned to do to help them survive. Sometimes that's committing crimes and stuff like that. So while that's not good, what we're trying to do is slow that down from a crime every day. You start with, okay, let's do one every other day. And then you want to get to, it's once a week. And then you want to get to, it's, once a month. And then you want to get to, okay, now we're stabilized. So that's meeting people where they are and not building all that stuff up on them. And it's coming together as a community. I know I've cleaned some rooms that someone, wrecked and stuff. And, they didn't do it directly, but because they were working on this path and I knew that they were trying to do it, that allows us to come in. So what we want to do to meet somebody is say, okay, take a couple steps. It's like teaching a kid to walk. They just don't walk the first time. You gotta, massage it a little bit. So, and if we can do that, just those actions change the world, change our world. And it's not a huge thing. It's just that we're looking a little differently. And then those folks that see that officer that helped out so-and-so with their dental stuff, they go, wonder if that officer could help me. The clients know the difference between the walking patrol and the regular patrol, right? Because the walking patrol wants to help them. And I'm like, hey, I want to help you do some stuff. And they're like, hey, I like help. So as a Black man, to be able to say, I like help from a police officer, that's like amazing, because the institution was meant to put me in prison, not to help me out. So that's going to do a change. That's magical. So that if I can go around as a Black man and brag about Olympia and say how great it is to live here, because they'll help you, maybe more Black people would want to live here because we want to live in a place where the police are actually helpful. So that's a huge change. That's a game changer from where I'm coming from, to where a police car can stop and a dude can jump out and I can go, oh man, I know you, and give him a hug. Because that's what I want to do with everybody in Thurston County. I just want to hug them, you know, platonically, you know, I want to hug them and say, hey, how you doing? I hate police cars with tinted windows. I don't like that, because I want to have a connection. I want to know who you are. I want to have lunch with you and breakfast and with all my neighbors. Shoot. So you just got me going on. I don't even know what I'm talking anymore. But what I am talking about is that, you know, we need to love one another and show each other, you know, respect and dignity and things like that. That's what we want to do. And we can do it. There's restorative justice programs where people get to talk and listen to each other. There's dispute resolution centers where people get to have mediated disputes with one another and pass the talking stick and things like that. We can do that. We can do justice where people actually get listened to for about what they want. Because generally when people want help, it doesn't mean they want somebody to go to jail. This means they want help. Right. And if we listen to them and have them take agency, more people taking agency about what they want to help. Because while it was nice for me in the legal system, legal problems with my son, people knew me. So I listened to what I said. It was great. That's what every citizen should have me. I know I'm a Black dude and everything, and I shouldn't have got it, but I got it because of who I was. And they said, no, it's not. But it was. And so that's what every citizen in Thurston County needs, is what I had, which is people that listen to me about what I want and what I thought it. And then I could trust them and they could trust me and see where we got. That's what people need.
Yeah.
I think that when we talk about programs that work and what would work here locally too, what Larry said really just hits the nail on the head there. Is you can name 50 to 100 programs on a national or worldwide level that are effective and work and have the data that show that they work. And the one thing every program has in common is they asked people what they wanted and then they did that thing. Like if you look at like the large scale model, what Portugal does with drug decriminalization, when people have drugs on them, they don't arrest them. They connect them to treatment and social workers and things like that. They don't say, you have to stop using drugs, we're going to put you in jail. They say, we see you're using drugs. How can we help? What can we do? It works. Another one, as far as harm reduction, the Dope Project in San Francisco, they test drugs that people bring in and then they publicize on social media and in person what the drugs were supposed to be versus what they test as. That's something that needed. People say all the time, I want to know what's in my drugs. It's easy to deliver that service to people, and it's harm reduction because you're reducing the risk of overdose and you're reducing the risk of somebody taking something that they don't want to be taking. People are going to use drugs. We're never going to eradicate drug use. But we need to be able to do everything so that people can do things in the safest manner possible, which includes things like harm reduction and drug testing and things like that. Familiar Faces and LEAD, like Larry's talking about, that's an entire program based on, we're not going to put you on jail, but we want to listen to what you need. Like Larry's talking about laundry problems. That's a big one. That's not an awful problem to have in the grand scheme of things too. Like that's a good one to be able to fix. It really, when you're looking at what programs work, sitting down and talking to someone in a way that isn't performative, that isn't trying to do something for social media, that isn't to do something to check off the list and say, I was a good person. I toured a camp today where I don't live. And actually getting to know people. And once you have organic, meaningful relationships established, saying, what do you need? Because sometimes those things are really low barrier and can be provided really easily by agencies or by individuals. And they make a really big difference to people, and asking people what they need and serving them in that manner versus trying to conform them to fit into a program is so much easier and so much more effective at having them be successful in their own life for how they want to be successful.
The other thing is it's a two-way street. So it's, what do I need?
Mhm.
Right? It's like not thinking that I am better than anybody else. I got stuff that I need. And so one thing, yeah, so it's a give and take because it's a human relationship. And so I think humans feel better when they're able to share with one another. And so, when clients have shared with me, and I don't mean like in a monetary way, but, when you're able to pass it forward in some way or assist another human being, you gain confidence. Like, oh, wow, I can help people. And, a lot of folks who have gone through these things give back to people all the time. So giving people an opportunity to practice giving to others is tremendously helpful.
Well, and I think that that's just such an important, cap on this conversation, is that nothing that we're saying here today is to deny that harm and loss and pain and whatever can be caused, and drugs can be involved in that, or that there aren't these sort of negative secondary behaviors that you're talking about, Katie, earlier, that we don't all want to see resolved in our community. We do. And to say that helping people stay safer in whatever way is possible for them is not at odds with an abstinence only pathway for someone's recovery. It's all part of this web of options that we need to believe is possible for any person, that there's an option possible for every person. Like, it's the most dismal thing in the world to me when I think about our community giving up hope that there's not an option for someone. I'm like, no, there's always an option. We just got to get creative. We got to get fun. We got to get fun about it. We got to get weird about it. And we got to not be so trapped in this either or thinking all the time. And Larry, I know that you've got to jump off to another meeting here at 1, but I just want to say in closing, is there anything else that you really want the community to know about this subject before we sign off today?
I don't know. Love your family, your friends. Love people you don't know. We can all be a part of this. We don't all have to be counselors or in the criminal justice system, but we can all take a moment to listen to somebody. And sometimes what I do is I just time it. And I go, okay, I'm gonna listen to somebody for 10 minutes. Bam! I just hit that timer and they just go. And people feel a lot better after they've been listened to. I know I feel a lot better after I've been listened to. And I'm not asking people to tell me what to do. Just listen to a brother every once in a while. And so that's what I hope that we would do with one another here in the town that I live in and in the planet I live in, is listen to one another. So I guess that's my greatest message right now. Thanks. I really appreciate that you called me to do this, or emailed me, or however that works. Thank you so much, Meg, for this opportunity. And Katie, it's always, people don't maybe realize this. Katie Strozyk is amazing. Her leadership with the opioid task force has been outstanding, and has really led to a lot of amazing things in our community. And she really needs to be praised for the work that she's done. Thanks for this opportunity, Meg. Thank you.
Thank you, Larry.
All right, bye-bye.
Thank you, Larry.
Katie, do you have anything that you'd like to add?
I think my biggest thing comes down to, in short of summarizing everything already, is really working on stigma and having everyone try to take a second during their day or multiple times of their day to think about the things that they are thinking, both, and also saying or typing on Facebook or whatever, because the things that you're putting out, you're often not aware of the people in the room who it actually is affected. I've seen it happen a lot on Facebook where people who are close with me say something, or in meetings, and it can come off very, very hurtful for people to have judgment. And it's hard for people to take a place of being that person to constantly educate, because that's not someone's role, and it's not someone's role to have to put all their trauma on the line constantly in order to try to fix stigma for other people, but just to be more conscious about the things that you're saying and thinking, and try to look at where that's coming from. Is it coming from a place of judgment? Is it coming from a place of discomfort? Is it coming from a place of hurt? I know a lot of people have really strong feelings about people who use drugs because they've lost people who use drugs, or they have been parents or siblings to people who use drugs who have maybe stolen from them, or they've been in that addiction cycle with them. So they have really big emotional responses. And so just when you're communicating out, thinking about where that communication is coming from and making sure that it's coming from a positive way in your communication with positive intentions, rather than trying to bring things down. And if it is in a negative way, trying to find out why you're coming from that space and how that can be adjusted to be neutral or positive in the future. Because putting all this negative stuff out in conversations is only going to cause further isolation and harm to individuals who use drugs or individuals who have used drugs in the past. And isolation is going to just put us further from where we want to be, because you can't build relationships based on isolation, and stigma does that.
Yeah, and I think that also, perpetuates that shame blanket is what it's like, the weighted blanket of shame, and that the stigma, people who use drugs and who are actively in that place, they're not immune to the pressures of the world. And so a lot of times folks, even when you are asking what it is that they need or want, their self-worth and their self-esteem is so low that they're like, oh, well, I just need to, pull myself up by my bootstraps. I just need to get a job, or I need to get this or that. And it's because of that blanket, that weighted blanket of shame. And so, going to that place of really listening to people and letting them know that they are worthy, that they are loved, that they don't have to be someone that they aren't in order to be accepted. And I just feel like everything that you have said today, I hope that folks are listening. I hope that this can open hearts and open minds, because like I said, we all want the same thing, which is a healthy and happy community of people that don't need to rely on harmful things in order to feel safe. So thank you so much, Katie, for joining us. It was awesome talking with you. Folks, if you missed this episode, you can view all of our past episodes on YouTube or on our website, interfaith-works.org/leaninolympia. Remember to like, subscribe, or comment to join our conversation. Again, huge thank you to you today for being here and talking with me. We've got a couple good events coming up on our website events page. You can check out the Thurston County Virtual Hunger Walk that's happening now through May 2nd. We are just $5,000 away from our goal to support ending hunger in our community, so please join us. And coming up on May 4th in the evening from 4 to 6 p.m., you are all invited to a town hall and Q&A webinar update that I'm going to be hosting about all the happenings in Interfaith Works Homeless Services right now, which spoiler alert, there's a lot going on and it's all very exciting. So yeah, please stay involved, visit our website, and every day we do this work with the entire community in mind. We can't thank you enough for walking this path with us. So take care, Katie. Take care, everybody. Thanks so much.